Hey everyone, this is Sunday with Farmers Business Network, and I'm here today with Jody Batesel, who is our program manager for FBN Health. And she's going to help us answer some tough and confusing questions that you may have about health plans today. So, Jody, tell us a little bit about open enrollment. What is it? When is it? What do farmers need to know?
Okay, so open enrollment begins November 1st and runs through January 15th in most states this year. So what that means is that is the time that most health plans are open for people to choose, particularly on healthcare.gov, which is also known as the ACA Marketplace. That is what really dictates those dates. There are a lot of different health plans, though, that do allow enrollment throughout the year, like FBN Health. We are not subject to open enrollment. We are eligible to enroll people all year long.
Gotcha. And so, as sort of open enrollment approaches, or as maybe someone's considering a plan that sort of falls outside of those dates, what do farmers need to know about it when they're thinking about their different options?
There are quite a few different options depending on each farmer's situation. So if they are a family where it's a husband and wife and some kids, perhaps they have the option like FBN Health. We do right down to two lives, two employees is what we would consider them. In most states, there are some states that have other requirements, but the majority of our states do go all the way down to two. They could also look at the marketplace, which is healthcare.gov, to see if they are eligible for subsidies, which some farmers are and some aren't. It just depends on their income and a few different other factors. They also could look at private options. Typically, those are going to be a lot more expensive. Usually what we see is if the farmer is eligible for a subsidy on healthcare.gov, that's the best way for them to go. If they are not eligible, then typically FBN Health has been able to save them some money there.
Gotcha. And speaking of sort of savings and how they can prepare as they're looking at different options, what's your best advice on getting a good price for a family health plan?
I would say do some research, see what works best for you, apply to different things, apply to ACA if you have not. Unless you already know that you don't qualify for a subsidy, apply for like FBN Health, for example. Our application takes about 30 minutes and you'll be able to know within 7 to 10 business days what your rate will be, and you'll know if you'll be able to save some money there. We do have a lot of farmers who choose a higher deductible health plan that is HSA eligible. That's a way that groups can save on their monthly premium because they are doing an HSA as a higher deductible plan. So therefore the premiums are a bit lower. It really just depends on what fits each solution. I would just say take some time, do some research, and figure out what's best for you.
Gotcha. And is there anything you'd like to add about FBN Health as an option for farm families? Anything that you haven't mentioned in the other answers?
Yeah, the thing that's new about FBN Health this year compared to last year, we are in all 50 states this year. That is something that we were not able to say last year. So we're excited to be able to offer that in all 50 states. We do also have an enhanced ambulance coverage this year. We sort of brought it out last year, but it's really in full force this year. And what that means is, a lot of our farmers are in rural areas where it might be a distance to a hospital. And if they, have an accident, whether it's car accident, farm accident, et cetera, it can be really expensive if they have to take an air or land ambulance. And a lot of times other insurance plans will only cover a portion of that. So say it might be $40, $50, $60,000 for an air ambulance should you need one. Your insurance may only cover 20,000 or maybe 30. So now you as the customer are getting billed for $30,000 that you didn't know you were going to be responsible for. With our plans, we cover that extra at 100%. So our farmers don't have to worry about having a big bill like that. And that's just one of the ways that we've tried to tailor our plans to our farmers who are in those rural spaces.
Awesome.
And
Well,
and one more thing. Sorry, I forgot
yeah,
one
of
more thing.
course. Yeah,
Medicare supplement. We
yeah.
do have Medicare supplement for our farmers who are aging into Medicare. So those folks that are 64 plus. And the nice thing about our plan is it's guaranteed issue. There's no physical. you just apply and you're good to go. So I wanted to make
Awesome.
sure I covered that too.
Of course. Yeah. We don't want to leave that one out at all. So awesome. Well, that sounds great. And I know we always try to wrap up with somewhere that farmers can go if they want to learn more. So in this case, you can visit fbn.com or fbnhealth.com. And then there's a big green button there to get a quote. So fbnhealth.com and then get a quote. Like you said, it only takes 30 minutes. So that's awesome. But thank you so much, Jody. I feel like this was really helpful. I learned something about our FBN Health program. So that's great. And thanks for sitting down with me.
Yes, thank you.
Awesome.